Hi guys, welcome back. It is Monday, so this means we're back to bring you another Medical Mondays with Dr. Apgar.
Hi guys.
Hi. So today we are talking all about cannabis methods of ingestion. And I feel like not a lot of people know that there are tons of methods. I think that you see movies maybe and think that there's one way and it's to smoke, like the stereotypical ways. Right. When really there's vaping, there's smoking, there are topicals, tinctures, and oral products. Right. So we're going to talk a little bit about each of them and maybe who they would best or what they would best treat in terms of symptoms and teach you a little bit about each. So we're going to start with vaping and smoking, and they are different.
Right. And obviously, Sierra, we at Greenhouse Wellness feel very strongly about encouraging our patients to vape instead of smoke. When cannabis is combusted or smoked, a lot of the good compounds are actually burned off. And so we want to encourage our patients to vape the product or vape the concentrate, which is a safer delivery method. Both of these methods reach the bloodstream very quickly. So if you're in severe pain and you need instant relief, vaping or smoking is going to be a really good idea for you to get that instant relief. And say you have a hard time falling asleep. That's another really good way of medicating yourself quickly so that you get the results right away.
Lots of things to show
and
tell. We have different vapes, so packs, the G-Pen. We have different options as far as, concentrates, flowers, going inside of these different pens. Would you say this is the quickest method in terms of feeling relief?
Absolutely, absolutely. And we know this is really overwhelming, but we don't want it to be overwhelming to you. And quite honestly, that's why you come to us, so we can kind of direct you. But this is just helpful for a lot of newbies out there who don't really know what they're doing and they feel like cannabis is very overwhelming. We're just trying to break it down for you today. So this is an example of a disposable concentrate pen that you would vape. And these are, like I say to all of my patients and to myself, this is idiot proof. So there's no charging involved. You just hold it up to your lips, you inhale, light comes on, lets you know it's working. There you go. In about 10 or 15 minutes, you're going to really feel the effects of that. Sometimes even faster than that. So that's an example of a disposable vape pen. Then we have concentrate different vapes here, like these little cartridges. This is just an empty one. It's just an example. But you can get these in all different strains, different strengths for different indications. And these just screw right on these batteries that we also have for you here. And then you have a different way. This is actually a rechargeable way. And then you can change this out with all the different strains that you might need during a day for different relief. And again, this works within about 10 or 15 minutes. Okay, then we move on to the vaporization of the flower. And this is a PAX. And this is really a great device. We love the PAX. The oven is down in here. You put your flower down in the bottom here. And then you just hold it up. It's very sexy. You turn it on this way. We like this one. It kind of vibrates when it's warmed up and ready to go. And then you just sip on it. And the vapor comes right through the top here. So this is the PAX. And then this one is very, very popular. This is the G-Pen. Sierra has seen a lot of these be sold here for sure. And people come in looking for the G-Pen. This is the #1 vape pen that is actually sold in the United States. So this one's very easy to use, similar to the PAX. And then we actually have a safer option for smoking. We have the Genius pipes, which are pretty cool. They come in 3 different colors. They're pretty. Yeah. They're really pretty. They look kind of like an iPhone. But they slide. They're magnetized. You can wash them in the dishwasher. But the doctor in me likes the science of this. And what happens is that all this surface area in here helps to cool the smoke. And it makes it room temperature, so it's less harmful to your lungs. Also, all these ridges right here, it catches the tars and the toxins so that, I'll show you where to put the flower here in a second, but all the toxins and the tars get trapped here so they don't actually reach your mouth and your lungs.
So cool.
So this is pretty cool. You would put the flower right in here, and then you slide this, put the lighter here, hold it right up to your mouth and inhale. And when you're done, you just extinguish it. So again, we are not thrilled with people smoking, but we get it, and this is a safer option for patients to smoke.
Cool.
All right, darling,
so
what next?
Next, we are talking about topicals. So how do topicals actually work? I feel like a lot of people come in and say, how is that going to help me at all?
Okay, so it's really interesting. The skin has a ton of cannabinoid receptors, and actually topicals work exceptionally well because the cannabinoids penetrate and go ahead and affect those receptors right there. So if you're having pain in your elbow, you've been playing too much tennis, you can actually put some of this amazing Synergy balm on, and it just stays right in the tissues. It doesn't get into your bloodstream. It doesn't make you feel high. It doesn't make you feel altered, but it gives you really good pain relief right where you've got this chronic pain going on in your elbow. Same thing with these patches. You can put the patch over the area that hurts. Like if you've got terrible cramps and you want to put it over your belly, you can put it right there. Or if you have generalized pain, you can put it right over your wrist or your ankle where your skin is very thin, and you get better absorption that way. This is going to take a little bit of time to work, though. It's not as quick acting as the smoking or the vaping. I'm going to say that this could take up to probably 30 minutes for you to start feeling the effects. But this patch can last for 8 to 12 hours, which is pretty amazing. And we have some patients that, as you know, Sierra, they combine this with the Muscle Freeze by Mary's Medicinals, and they kind of mix and match. So there's a lot of different products, not just this, that we have to offer here.
Yeah, so a lot of patients come in who have like localized aches and pains, and they combine these products, and they truly really love it, and it works. I have a question from Kate. Does balm show up on drug tests?
It's not supposed to, because it doesn't get absorbed in the tissues in any appreciable amount. So obviously more studies are pending on that, but I would say it's probably pretty safe to take a balm and put it on topically, as long as you're not ingesting, like drinking or smoking or vaping the flower. I think you'll be okay.
Cool, it's good to know. Next, we're talking tinctures. What are tinctures? A lot of people don't even know this word.
Right, tinctures, that's a funny word. We're kind of going back to old ancient medicine, but this is a concentrate that is in concentrated liquid form. It can be in an oil, or it can be suspended in ethanol base. And this one by Dixie is actually half and half CBD to THC. We have other tinctures that are stronger that have just the THC. And what I'm really excited for coming down the pike is when we get all the components of that flower. You've heard me talk about terpenes and all these cannabinoids, but I would really like to see that evolving as we move into therapy with tinctures. But I like tinctures a lot, and I think tinctures are underutilized. I think especially for our older patients and our patients who are really adverse to smoking or vaping, this is really good medicine. This is something that comes in an eyedropper. It has little gradations so you can dose yourself appropriately, whatever you want to start out with. And these are used under the tongue. And these are used also to dilute and do microdosing by putting in some water, some tea. We need to drink more water every day. It's a wonderful reminder to drink, but just to put a few drops in your liquid that you're drinking during the day is what's considered microdosing. So we use this a lot, these tinctures. Love these tinctures. These are great for chronic inflammatory problems, like say inflammatory bowel disease or even cancer, chronic pain, just to get this in the system. The faster way of getting it in the system is if you put it right under the tongue, and if you can keep yourself from swallowing for as many minutes as you possibly can, 3 to 5 minutes would be amazing. And then whatever doesn't get absorbed through your oral mucosa, then you drink, and then it makes it last a lot longer. So this would take effect probably within about 20 minutes if you put it under the tongue, and it's going to take a lot longer once you drink it down, because then it depends on what's in your stomach, what you've had to eat recently, et cetera, and that could be hours.
And I know that the suggested method is to take these on an empty stomach for that reason.
But it's still very variable, and everybody asks me, how long is this going to last and when am I going to feel it? And the answer is, I don't know. You can feel the effects from oral administration, from drinking a tincture in an hour to 6 hours. And that's why we have to be so careful with what's considered edibles, which sort of takes us into
exactly
our friend the elixir. And this is probably one of the things that we sell the most of here at Greenhouse Wellness. I mean, this is our really good medicine. So this is kind of like, I guess you could liken it to cough syrup. It doesn't taste like cough syrup, but it's the same idea. It has a little medicine cap here at the top. There's a little mark right here halfway up. You would dose yourself with either here or even less, depending on what we advised you, maybe an hour before bed. And that really helps with sleep and pain, and it gives you 6 to 8 hours of relief. So this is one of probably the things we sell the most of here.
A great seller, yeah. And the rule is start low, go slow. It's super important to listen to your wellness consultant or Dr. Apgar or whoever you talk to regarding like what we suggest for your first dosage.
The danger is that you take too much, and maybe you don't feel it, and so you take another dose, and then 2 hours later you can't get off the couch, and you're not making sense. So that's the thing, that you have to be so cautious when you take things orally. Just really, really please heed Sierra's advice to go slow.
Yeah.
The last thing that we have over here are these mints, which are very, very popular. This happens to be the peppermint mints, but we have them in Awakening or the orange flavor as well, which is more uplifting. But the patients love these.
They absolutely do.
They call Sierra, ask for them all the time.
So let us know if you have any other questions. I think we answered. I think Kate had another question, though, that we missed back to the flower.
Got it.
Do you grind?
Yes, so this was another device. Thanks for noticing, Kate. This is actually a grinder. And so what sometimes patients will do, because maybe they want to vape their flower at home, is they'll buy flour, comes in a container that looks like one of these. This is actually, I'm going to give a shout out to SunMed Growers, which we just started carrying. New Grow came online. But these are cool. They're actually is a plastic lining. You can show. Closer.
So they have all the info as usual on the outside, but this is so cool. There's nothing in here, obviously. It's a sample, but this is clear. So you can open it up and see right through.
See the quality of the medicine, right?
Yeah.
So we're very excited about that. So anyway, let's pretend you get your flour at home, and then you have one of these really cool grinders. You would go ahead and put some of your medicine right in here, and then you grind it down so that when you open it up, it's very easy. It's a finer consistency, and it's able to fit into here, into the oven here, or in the G pen, say, right into the very, very top of the pen. The top pops off, and that's the oven right there.
Right.
So it just makes it easier. Sometimes people choose to use their fingers, but this grinder is a very slick option as well.
It is, and I want to touch on why we like why it's important to use a high quality,
high end
grinder. Why?
Well, because we don't want metal shavings. We don't know who the heck is making these. We don't know what's being tested. We are so organic in Maryland, and we insist on these ridiculous growing conditions. They can use nothing on, no chemicals on the plants, which is amazing for the patients because they're getting all of that quality, and we know that. But then you buy a cheap grinder, and
on
now
Amazon
you have
or wherever.
Yeah, and now you have who knows what in your flour and in your lungs and in your body.
Exactly.
So we do really value these high-end shredders.
We have the Santa Cruz. We love these.
Yeah, we have them in all different colors.
But just make sure, just make sure. A lot of people don't know that, and obviously you don't want to be ingesting that stuff.
No.
So we hope we answered a lot of you guys' questions. Continue to drop any questions or concerns below. Hi Phoebe, hi Halsey, and have a great rest of your Monday. We'll see you next week.
Happy Monday.
Bye guys.